Welcome back, everyone, to another fabulous episode of Healthcare Trailblazers. I'm very excited and honored to be sitting here today with Dr. John Whyte, the CMO at WebMD. WebMD is the number one, the most traffic of any healthcare website goes to WebMD, and that's according to SimilarWeb. I looked that up, so so that's really cool. Dr. Whyte has had some really interesting stops along his way to what he's doing currently, and we're going to talk about a whole bunch of really interesting topics. Thank you so much for joining us today.
I'm delighted to be here. Thanks for having me as a guest.
Absolutely. So if we can jump right in, you've had stops at CMS, the FDA, Discovery Channel, and then finally where you're at today as the Chief Medical Officer at WebMD. Talk us through what, and each one was quite a number of years. You know, it wasn't just.
I tend to stay somewhere like 7 years on average.
That's what it seems like. You've got a good average going. But talk us through what some of those experiences were like, what the job function was, and then how kind of that all led to and added to what you're doing today at WebMD.
And, you know, I've been someone who's been in and out of government, and I wish more people would spend some time in government and then come out of government and go back in, because you learn a lot of valuable lessons. But for me, you know, I mentioned beforehand, I'm still a practicing physician. I only see patients about 20% of my time, but I've always have done that, always, no matter what job I've had. That kind of was a key component. And I came to Washington, D.C. more than 20 years ago, because I said I wanted to do health policy. And in many ways, I view myself as a policy person. And I came to CMS Medicare to help decide certain services that Medicare would cover or not cover. And it was a great opportunity because it was clinical, because I'm talking about the delivery of care. It's very much a policy position, because what Medicare does, other people follow. And it really, for me, was a great way to see how the government functions, particularly on the executive branch. But I never thought I would remain a government employee forever, even going in. That wasn't my goal in life. And I've always been open to opportunity. And that's something I think is important. So early on, I thought, Mendel, I would be a surgeon. Well, I'm not a surgeon. I decided I didn't, you know, I didn't like that as much. I wanted that personal relationship with patients. Then I thought I would be like an academic chair, right? Like a department of medicine at a big academic institution. And I don't do that either. But I've been open to the opportunity. So actually, when I was at Medicare, Discovery Channel approached me and was like, "Oh, we want you to head up this health and medical program." And I was like, "What?" Like, I'm a doctor. Like, that doesn't make sense. Yeah. And they're like, "Oh no, like, you know, you'd be perfect to help guide us into decision making about what topics we cover." And I'll tell you, several of my colleagues and friends said, "You know what, that's a great opportunity. That's translating research into practice." We never called it that, right? So you could do a show on diabetes, you could do a show on cancer and get millions of viewers worldwide. That has tremendous value. And I remember people said to me, "Well, go there, and if you don't like it, call it your sabbatical." I mean, that's a term only, like, you know, academics use. And my sabbatical was about 10 years.
That's it, yeah, that's great.
So that the point was, I've been in and out of government, but really have focused on how do I impact people's lives, right? How do I impact people with good information? And that's really what I've been focused on.
Cool. So that's your central focus, and that's what's led you till today.
Yeah, all the jobs. I mean, I headed up an office of engagement at FDA on drug development. You know, at WebMD, I'm all about how do we communicate the best information. So that really has been, you know, my focus. It's funny, I don't see myself as a media person or a communicator. A lot of people see me in that role. I see myself still as this policy person. Like, I'm trying to advance, how do we think about tech? How do we think about addressing issues of disparity? And I'm using these platforms that I'm at to make sure we provide the best information to people.
That's awesome. So but yeah, and it's interesting because your different stops, like you said, in and out of government. So you went from CMS and then you FDA, Discovery Channel. I'd imagine you picked up little pieces and that it came together to really help you with what you're doing today at WebMD, because it's kind of a bit of both.
Yeah, I mean, absolutely. Each job, I think, is for many of us, you know, helps make us better, right? And then we take what we learn from each, you know, in government, I joke, it's about meetings all day. I mean,
yeah.
I don't know when you get your work done and 50 people come to a meeting. You know, in the private sector, it's about what meetings are important. how to get things done. And, I very much enjoyed my time in government, but I mean, this is serious. I'm not joking. You'd have a meeting and you'd be like, in government, okay, this is going to be released in October. And someone would say, what year? And they were serious. Now,
Oh my
I mean, it'd be
gosh.
September and you'd say, we're going to release this in October. And you have to get it done. But that's, those are different processes. And there's a reason why we have those different processes, both places. But they also help you do better in each of your jobs. And when you come in and out of government, it helps you become better too. But also in the private sector, it helps you think through certain things.
Yeah. Well, that's interesting. That's really cool because it's interesting that you went there for a very specific purpose. And by there, I mean, to work in government. I think a lot of people that are, their entire career, they're in government, they probably don't have the perspective that you were able to gain, but you went there with a specific purpose, you took it, and now you're plugging it into WebMD. That's awesome. Yeah.
Well, not everyone likes change too. So in some ways, you go somewhere and you think you'll be there, 20 years or 30 years till you retire. That's not quite the same in most places nowadays. It's still a lot of government. There's a lot of incentives to stay. But, I find that it's good to innovate and reinvent yourself to some degree, every few years and keep moving forward.
That's awesome. Don't stagnate. And clearly you picked up some friends along the way. I saw you had some very notable interviews. You talked to Dr. Fauci and a lot of people that are, definitely there. So cool. So you talk about a lot of in really interesting subjects when it comes to healthcare, and we'll try to get into as many of them as time allows for today. But definitely there seems to be almost an epidemic today of health, mental health and emotional health. People are not happy. People are unfortunately killing themselves at ridiculous numbers. And we seem to, on the outside, have life so good. I mean, you think 100 years ago, and you think, just for me to have messaged you to arrange this meeting would have taken so much effort. And we seem to have life so good, and yet we're not happy. What are some insights as to how can people become happier? What are steps people could take to have better mental health?
We have this infectious disease pandemic, coronavirus, but we also have this mental health tsunami that is upon us. And I think we're finally getting a recognition that there's no physical health without mental health. It's the same in reverse. And we really have known about the mind-body connection for thousands of years, but we've never really have done anything about it. And, we haven't had good payment for mental health services. There's still a lot of stigma in many communities as well. So first of all, we have to break down those stigmas, right? We have to acknowledge that it's okay not to be okay. And we have to recognize that mental health is a key component of your overall health. And we have to apply more resources, just as we do in diabetes care, just as we do in cancer care, and make services available for people and let them know how they access it. And let's be honest, if you have severe depression, you have PTSD, that's not going to get solved in 1 or 2 sessions. That's going to take time, and we need to devote that time and devote those resources as well. And I think we're starting to have more of those conversations, but certainly we need more.
So, question. So I talked about this with some other doctors on the show. Are you a fan at all of kind of the psychedelic revolution and those going in that direction?
I'm not a particular fan. It may be my bias having worked at FDA. I think we need to have the data. I think we need to look at studies. We don't just ingest things that could have impact on our mind and body because someone told us or we think it might be a good idea.
Yeah.
Everything has risk versus benefit. That's everything. Food, supplements, drugs, and we carefully have to weigh it as well. So I say, let's look at the data and then make a determination. So I'm agnostic.
Okay.
Right.
Waiting to see.
Yeah.
Yeah. Good. See that FDA experience there. Definitely. Very cool. So were you at CMS in 2015?
No, I was not. No, I was at FDA at 2015.
Okay, cool. So still government. So one of the interesting programs that came out in 2015, and they just doubled down on it, and it's what we do for a living here at Proviva Health Group, is chronic care management. So
Sure.
so that's what we do is we basically leverage technology, we stack a clinical team on top of that, and then we integrate with practices and we get the program done for them. And it's such a great program. I was last week at a conference, a rural health conference in Virginia, and was able to present on it and talk about it. And it's something that's picking up a lot. It's becoming more popular, where doctors are actually doing it. But what I think is so powerful about the program is it's obviously a focus on prevention, which I think is something you talk about a lot. But the idea is you have a care coordinator and they're building this care plan with the patient. And the idea is to build that care plan with the patient. So you take the information from the EHR, whatever it might be, but then you have a real human conversation with the patient. You try to understand a lot of the factors behind why they have certain health challenges, and try to create solutions that come from the patient in order to get them compliant. And I think that's really interesting. So I think a challenge is with a lot of different parts of healthcare is that it's kind of like the doctor talking at the patient. And it kind of feels like when you go to the dentist and they ask if you brush your teeth twice a day and floss every single day, and you kind of feel like if you answer no, then, you get on the naughty list. They go extra hard with the cleaning, So what are some tips and some guidance on how to partner with patients so that you can put the patient almost in the driver's seat, so that the patient you're working on goals for the patient's health that they want to drive for, because at the end of the day, that's the only way that's going to work.
I think you're exactly right. And I think there's still a lot of doctors who have this paternalistic attitude. I'm the doctor. I told you to do this, so you'll do it. And that's just not the way things work. They never were that way. And the patient really would just say, yes, doctor, and then we really wouldn't see any improvements. It's really now about shared decision making, right? Let's talk to the patient to find out what their goals are, what's important to them as it relates to their health, the quality of their life, and develop treatment strategies based on those goals. But the issue is, Mendel, it takes time to have those conversations. And right now, doctors are particularly overworked, burned out. As I mentioned, I still see patients. The clinic day is very busy. And for some patients, it's kind of a startle when I talk to them about, kind of this shared decision-making concept, because they're not always used to it. But that's what's going to change things. And this is the overall concept of patient centricity. How do we make patients the center of the care? It's always been focused on the physician. How do we keep the physicians happy? Now it's about how do we provide the best care to patients and focus on them? How do we make it convenient for them? Do lab tests at home, use the data from wearables. They don't have to come in as often. I mean, those are the things that we need to be talking about. And, some doctors, especially younger doctors, somewhat generational, are willing to have more of those conversations with patients. And, on the part of patients, I think patients have to come informed, ask questions. I always say, don't leave until you get all your questions answered.
Yep.
Mendel, the bigger concept here is health happens outside the doctor's office, right? Do I really care as much about your blood pressure, what it is at one point in time you come into the doctor's office once a year or twice a year, but really what's happening at home? What are your blood sugars doing throughout the day? That's where I think we're going to see the fundamental change, and patients are going to become more involved in their care, and we're going to have more of this discussion. And that's really what it needs to be, and less of this, I told you, and I'm the doctor, because that never worked, and it certainly doesn't work.
Yeah. Right, yeah, absolutely. And I think that was actually the first piece of content that I think connected us, was you talking about the blood pressure cuffs. And we have a remote patient monitoring program here. When we send them out, we do the whole connectivity thing. So that I definitely appreciated that. And absolutely, going to the burnout thing for a second. First of all, I would imagine that should doctors do what you're saying and focus more on empowering patients at home and technology and digital, as we'll talk about in a second, that should probably help with the burnout issue, because things are more structured.
In theory, but physicians have been told many times things would make their lives easier. I was around when we said electronic health records are going to make our lives easier. I'm not sure that's the case.
Really?
I mean, right now the attitude is, don't ask me to do one more thing right now. Unless you can show me upfront and immediately this is going to save time, result in better outcome, make my life easier today. So I think it's just the attitude right now is, I don't know, because I think all these things are iterative in the digital space. All this great information, it's very unstructured in
Yeah.
terms of the workplace data. We need to have it structured so I can do something about it. So we're going to go through a period of time where there's going to be some bumps
Hmm.
along the road, but I do think we're going to get to a better place.
Okay. So that actually segues into, what do you think are some of the advantages and disadvantages of technology and digital as it comes into healthcare? From wearables to, you mentioned there's pros and cons to the EHR.
Yeah.
So what are some of the advantages and disadvantages in your view?
Of digital?
Yeah. And general technology becoming more and more
Yeah.
prevalent in healthcare.
I think it becomes more convenient for patients, right? Because they're going to be able to do a lot more things at home. They don't have to go to the doctor's office. I think it provides more control of their data, right? Patients often don't know, what are my lab test results? The doctor's office says everything was fine. But now patients will have it themselves. It's more continuous data. Like I talked about, it's just not that single point in time that I go to the doctor's office where you're going to do my heart rate. We all have these smart watches and smart rings. I'm calling smart jewelry on. I mean, all of this I think is helpful. And when you think about it, it's your personalized data, right? It's precision medicine, a continuous glucose monitor, the Lumen device, food app where I can take pictures of my food and get data in terms of the nutrition quality of my food. All of that is tremendously helpful. But it can also be data overload, right? We have issues of health literacy, health numeracy. How do patients interpret this? How do they understand it? We don't, in many ways, need more data. We need to have a better understanding of the data that we have and package it. I can do a lot more things on smart scales at home. You talked about remote patient monitoring. Those are all great because, again, it puts the patient in control. They can do it when it's convenient for them. I would argue it's probably better data because they're not stressed after trying to find a place to park or take public transportation and then waiting. And then I'm going to get more accurate measurements. So I'm very excited about the role of tech and the role of digital tools and really improving patient care. But we still have to think through exactly how it fits in the health ecosystem.
Well, you seem to have a very human just perspective on challenges that patients face. So how do you think doctors as a whole, and probably more people in positions similar to yours that actually have the time and the platform, but how do you think those people can connect to patients and educate them? How do you think you can engage with patients on a better level so that you can actually leverage the continuous technology in a meaningful way instead of just, like you said, just an overload?
Right. And it is about understanding with patients what their goals are. Everyone doesn't want to use tech and have those measurements, but I think a large percentage of people do. But they don't quite know how to use it. They don't quite know how it'll fit in to the health system. And that's where I think sometimes we have to use more physician extenders, nurses, nurse practitioners, and they have their own independent function. Pharmacists play a great role, but to have those conversations with patients, understand what their goals are, encourage them to bring that information back to the doctor's office. And then, many doctors now are messaging patients, right? We're talking, outside of the doctor's office, what they can be doing. And I think we have to move away from this single point in time that you see me once a year or once every other year or twice a year, and have more of these conversations throughout the year with patients. That's what's going to create better relationships. And I would argue probably better outcomes too.
Yeah. Are there any specific companies that you're excited about going forward? There's so many companies that are taking this, that are finding some interesting balance and marriage between the human and the tech. There's one company that comes to mind, and I have no involvement with them, but it's called Care, something like that. And they basically, they've got this whole kit that you can send to the patient's home, and it basically allows the doctor to do a full ENT, like a full checkup. It's got all these attachments and lights and cameras, and
In many ways, healthcare is becoming retail. I had the opportunity to visit a Walmart health center. And I have known Cheryl Pegas, who is their executive vice president of health and wellness for some time. And I have to tell you, I'm impressed with what they're doing. Many of their stores are in rural communities, social and vulnerability index. they're all about community too, right? The pharmacists are from the community, the doctors are from the community. It's, the importance of fruits and vegetables that are reasonably priced. It's about convenience. It's about monitoring their, vital signs outside of the doctor's office and making sure, do they need a blood pressure machine at home? Do they need some of these other devices? What I'm impressed about Walmart and some others is this concept of total health, right? What happens outside the doctor's office? It's also your ability to buy food, to exercise safely, the social determinants of health that many people have been addressing. So I think, places, like Walmart are doing very well in rethinking health. I think all the continuous glucose monitoring machines out there are great because I'd like to see it be used more often. I'd like to see it used for prediabetes. I think devices like Lumen, where you breathe in and it tells you whether you're burning carbs or fats, and then helps you develop your own personalized nutrition plan. I mean, I think there's many companies like this that are trying to help use your data to create something personalized for you, whether it's an exercise plan or a nutrition plan or a sleep plan. I'd love to see more of those and see some of the data around them. That's what I think is exciting. Again, it goes back to health happens outside the doctor's office. You're more in control. You're doing things when convenient. And then, hopefully we're getting good data.
That's awesome. Very cool. So let's jump a step forward in the technology to AI. AI is something that's becoming, in all parts, in all industries, it's becoming something new and interesting, more cutting edge. But in healthcare, there seems to be some really interesting applications for it. So where do you think we're going with that? And what are some examples of where AI plays into healthcare?
I think where we're seeing the discussions around AI are some of the ethical issues that are going on right now. Whereas we're seeing there is a bias in the algorithms, right? You look at skin conditions, right? To determine based on, and there's lots of great apps out there to look at melanomas, other rashes. If these algorithms are determined primarily on Caucasians, how is that going to determine whether or not you have certain type of cancers if you're brown or black skin tone? We know most of the data for algorithms is determined in the US and China. Is that good enough in terms of, are we having representation of the data set? When we're looking at them, are they locked algorithms, meaning that this is how they determine whether or not you receive a certain level of care? Or is it adaptive, that it changes over time, that it learns, machine learning? I think these are all the important questions we need to address. I think where we've seen a lot of successes in triage, right? You come to the ER and you have these certain characteristics. Who's going to most benefit from going to the ICU? Who should get certain types of antibiotics? We've seen that. They're particularly useful is when they're adaptive, when they change over time, certainly in infectious disease. It's great to be able to look through medical records and see who might have familial hypercholesterolemia, high lipid panel, based on some genetic family variant that puts you at increased risk for heart disease earlier in life. That's going to be very helpful. So tremendous opportunity for AI. We see a lot of it in the use of radiology. I think we're going to see it in other spaces, but we need to be upfront in terms of what was the algorithm based on. Is it locked? Is it adaptive? Do we have diversity in terms of the data sets that people are using? But otherwise, AI is the future. We're already using it. But here's what I always say to people, Wendell. There's a great piece that said DARPA is considering AI to autonomously make decisions about airstrikes and things like that.
Whoa.
Right? And you think, is that a good idea? We say no, because that's our, our defenses. But what about our health? We shouldn't completely allow AI to make decisions. And sometimes if you're getting certain type of cancer care and you're using an algorithm, you want to know as a patient were people like me in it. So we have to disclose that. I bring up, and it's somewhat generational, I say, would people get in the AI-driven Google car?
Right.
Would you? I don't know. I'm older. Would you get in? I don't know.
But I get into an AI-driven Google car.
Right. So no one's in it. Not the one that they're testing, but say
probably where I live in Kingston, Pennsylvania. Definitely not in New York.
So, but these are the things we have to think about in terms of the use of AI. But we're definitely, there's there's so many things it can do in terms of drug development, so many connections that it could investigate that we can't. But the difference we're also going to see is what's practical, what improves outcomes. So, I can use a AI driven algorithm to say with 99% certainty whether an eye I'm looking at is a female eye or a male eye. And even a group of ophthalmologists who are experts in the eye can only predict 50% of the time. That's a coin toss, whether it's male or female eye.
Wow.
But I would ask you, the question now is, what does it matter? Who cares? Is it clinically relevant? Is it going to improve outcomes? And that's where I think we're going to see a lot more focus. What's practical? What's useful? What matters in our lives? And not in the past, it's been the glitz, right? The laser that can look at your heart signature from, 200 meters. I think it's going to be much more the practical stuff.
Interesting. Sounds exciting, to be honest.
It is.
And yeah, and it sounds to me, that a lot of the issues that you're saying will probably, it's probably where they're going to focus on. I know even like Google, when they started, they had like certain facial recognition features, and early on they got in trouble for things like you're describing, and comes up, you work on it, fix it. Very cool. So let's kind of jump over a little bit to corporations and companies. Personally, in our company, it's very important to me that our employees live the best possible life, period. And I think a lot of that is ancillary services and ancillary things to the actual office environment. So obviously you need a good environment, not a toxic environment and all that. But there's a lot of things that employees maybe go through at home in their general life that are going to impact their overall life happiness, and that obviously impacts their work. So even from a selfish perspective, you want your employees to have as stress-free a life as possible, and obviously a huge part of that is health. So what are some ideas in your mind to help your employees lead a healthier life, exercise more, diet? What are some ideas?
And let's recognize employers pay a lot of healthcare costs, right? It's the employer-based insurance. I think part of it is trying to think of new, innovative ways to address it. So, a lot of people are now going to be in a hybrid environment. Do we need that corporate gym or the gym membership? I'd like to see people offer more, some type of, you get a certain dollar amount for whatever subscription or other premium type of services you want, meaning maybe you want a self-meditation app or a mindfulness app, and there is a cost. Maybe you want to do a virtual reality, and that's going to work for you for exercise, like an Oculus or Supernatural. So wouldn't it be great if employers maybe gave you $50 a month, to do that? I wish we would have more mental health days, right? Additional vacation days, maybe 3 or 4, that you don't have to take out from your normal vacation day. Just you need a break. A lot of people are saying it's the culture. We should have this attitude of don't send emails over the weekend. Don't send emails after 5 p.m. or 6 p.m. And really, if we're going to talk about mental health too, well then you just can't walk the walk or talk the talk. You have to walk the walk. And I've heard people say, oh, people are saying it's okay to not to be okay, but then they want the work done and nothing's changed. And that's what I don't want to see. I want to see the changes. So I want to see more, if it works in terms of the environment that you're in a hybrid work environment, the issues of, paying for some of these other services that you otherwise might not get, because we don't want people that only have money to be able to get these digital tools, these apps, this tech that could improve your health. So I think employers could help a lot in this space.
Interesting. Yeah, it's funny. I would hope that you could create an environment where the answer is not giving people more time to escape the environment.
That's a good point.
Hopefully you could create something where that people enjoy coming to work. Obviously in some industries that's really hard. I mean, if you're flipping burgers, there's not that many ways that I can think of to really improve that experience. It's going to be sweaty, you're going to be on your feet all day. But I think especially, more office environments, I think there's so much that can be done just to create a much more supportive, friendly,
Absolutely.
environment. But That's all really interesting. So let's zoom out for a second, a little bird's eye view. You talk to a lot of leaders in healthcare, and you obviously, between your time in government and WebMD is huge. I don't know if people appreciate how large WebMD is, but it's really big. Was it? I don't remember the numbers. I think it was like 30 million.
It's about 75 million people coming.
75 million. Yeah, it's the traffic is just crazy. So you're doing a lot of things on kind of a top level. Where do you see healthcare? We're now almost middle of the decade. Where do you see healthcare kind of transitioning over to from a value-based care perspective, from any other perspective that you may have?
Yeah, I think we're going to see more about care at home, right? We've talked a lot about it in the past, but COVID showed us how much we could do at home. So we even did chemotherapy in some instances at home. How many of us learned how to do COVID tests, right? At home, use pulse ox, right? You're going to be able to do that for other type of tests. And we're seeing a lot of companies in terms of home testing. Why should you have to go to the lab in the doctor's office to get it done where you can do it more in your time? The use of remote patient monitoring, right? Doing all of those things at home, and wearables is remote patient monitoring. And they're just going to get better. They're going to be in our clothes and our contact lenses. That's going to be precision data, personalized medicine that's being done at home. And I think we're going to see the use of telehealth and telemedicine refined. There's this, mistaken approach that they're the same, a virtual visit and an in-person visit. No, they're not the same. They should be used for different things. We have to continue to think how we do that. But I do think there's going to be much more about patient centricity. Focus the patient as the center of care. Do more at the home. Do more outside the doctor's office. That's where I think we're going to see a lot of shifts. And it's going to be interesting as healthcare becomes more retail, right? So we buy those devices, buy those tools, how we pay for those and how we, change payment policies. We've been talking about value-based care for a long time, accountability. It'll be interesting to see how that continues to evolve over the next few years with the shakeup in terms of how I think we're going to be delivering a lot of care. And I think a lot more care is going to be delivered in the home.
Very cool. Can you what do you mean by the payment method? What kind of changes are you talking?
We're so focused on you come to the doctor's office, right? And that's how things are paid, right? Well, if you're doing lab tests at home, some FSA, some HSA pay, but how's that going to be?
Interesting.
Will insurance cover home lab tests more? Will insurance cover more continuous glucose monitoring for pre-diabetes? How will we, address there are remote patient monitoring codes, as you know, but how will those be revised to address, wearables?
Interesting. I think we got to see. I think we got to see Medicare partnering up with Amex and then offering, on the credit card anytime you buy, these categories, insurance.
Maybe we have to be innovative. Yeah. We have to think of new ways and ideas to pay for things.
Wow. All right. A lot of really interesting topics that we could, go on for hours and hours, but we're coming up on our time. Let's go through some rapid fire questions if you don't mind.
Okay, sure.
All right. When are you most productive?
Late at night.
Interesting. Wow. Different answer. Okay.
Why? What'd you think I was going to say?
No, typically you hear, people that I get up at 4 a.m. and
I'm not
those hours between 4 and 8 late at night.
I'm not really a morning person. I do have young children.
Okay.
Below the age of 10. So the mornings, I'm up early, but the mornings are chaotic. I need a little bit of silence. And then, I work at night.
Very cool. Yeah. And I feel you. I got a 3-year-old and a 3-month-old. So I know the feeling. Yeah.
That's great.
Who is your inspiration and why?
I would say my inspiration is my mother. My mother has always been someone who made me feel I could accomplish anything.
Interesting.
She would always say, Johnny, and no one other than my immediate family calls me Johnny. She'd say, Johnny, you can do that, or you should, think about doing that. Always was my inspiration in terms of made me feel I could accomplish anything.
That's awesome. That's really nice. Wow. Go mothers. Look at that. All right.
My dad too was always supportive, but my mother was always the very vocal one, the champion. And back then, my mother stayed at home, worked at home. My dad went to work, so I had a lot of interaction with my mother. Always supportive.
That's really nice. Well, on that subject. Let's talk to little, I'm not going to call you Johnny, but you'll talk to Whyte to me, but what would you tell your younger self?
I would tell my younger self, and I kind of have done this, be open to opportunity, be willing to change your mind. And I've done those things. Maybe I would have done it sooner and in terms of, thinking I was going to be a surgeon or what have you. But that's what I would tell myself.
I don't know. You've done quite a lot. I don't know about that. All right. Very cool. When you meet somebody, what's the first thing you notice about them? What do you try to pick up on somebody from energy or any perspective?
I do like names. Maybe that's why I try to remember names. I think that's important. But I'm always focused on like what their name is.
Huh. That's interesting. All right. And then finally, what's your most useless talent?
Like I've used your name a couple times.
You did, and I noticed that. And it also makes the conversation a lot more personal, which is nice. It's something I definitely have to.
And I think about the name. I was thinking, I wonder. I'll have to ask you later. Like,
yeah.
So I do notice names. Yeah.
That's really cool. See, sometimes these random questions have very interesting answers. All right, most useless talent. What is it?
I don't know if I have a lot. I'm not sure about that.
Good. Put all your talents to good use. That's a good thing.
That's probably true. I like to think that.
That's great. Well, Dr. Whyte, thank you so much for spending your time with us today. I know you've got a packed schedule, and it's been fascinating talking to you. You have a very, very clear vision of everything that you're doing, it seems, and that's obviously going to continue to guide you as you move forward. And it's going to be great to continue to see the great things that you continue to do.
Well, thanks for having me. Thanks for raising these issues. It's important to have those discussions. So I appreciate it.
Thank you so much.